Just about everybody watching the show this morning has had foot pain at some point.
I think it's my shoes. I wear heels all the time, and so then half the time you don't see behind the set. I put on my flip-flops, so you don't get to see. If I do a segment where I'm standing, I'll put them on because my feet hurt so much. We decided to bring in the good doctor, Dr. Maasi Smith, to talk about this one. He's the director of podiatry at the Urban Health Initiative. Thanks for coming in. We really appreciate it. Thank you.
Doctor, good to see you. Does it all start with the shoes?
You know what? This is the main culprit. Unfortunately, we have to show all women's shoes because 90% of the surgeries I perform are women.
Because men don't go to doctors.
Men don't come to the office.
You know something I had years ago? It was from constant running. I probably ran every other day for 20 years. I started to get that plantar fasciitis.
Yes.
And Chooch, our catcher for the Phillies, going through that right now.
Absolutely.
What exactly is it?
Extremely painful. What happens with plantar fasciitis is your heel, there's a band of tissue under your heel, and it becomes irritated. Now, it can become irritated through activity, weight gain, there's any number of reasons. But typically, these right here, women going from high heel shoes during the day and then want to cut over and put these on in the afternoon.
So it's not just athletics, constant pounding, but I'll tell you what happens. You get up in the morning, you forget that you have plantar fasciitis.
Yes.
You take that first step, and you roll down onto the carpeting or the floor in writhing pain.
Oh, it drives you nuts. It's actually one of the most common procedures I perform.
What do you have to do for it?
Well, you have to release the plantar fascia. That's why I love this little model right here.
Show me where that is.
The plantar fascia, here they don't really illustrate it as good, but under this muscle would be a thin band of tissue, and what we do is go in and release. Very simple surgery. A lot of people think surgery is something huge.
When you say release, you mean cut?
Well, yeah, just take a little thing and release. We release 1/3 of the plantar fascia. But look, by the time anesthesia puts you under and you wake up, it's 15 minutes later.
What's my recovery for something like that?
You know, recovery is very good because you're already in pain. That's what I tell people about plantar fasciitis. You're already in pain. So because you're in pain, the surgery itself causes you a little bit more discomfort. But it goes away in a couple weeks.
Something that helped me was that I think they, as I remember, it's hard to forget, put a big needle, cortisone shot.
Yes, that's one of the common treatments.
And then I had to wear an orthotic in my shoe for about a year.
Offer arch support, yes.
Okay.
Yes.
How about bunions? My husband runs a lot. He's got, you know, and I know women get it, you know, from our shoes all the time, but he's got a big old gross. That's exactly what my husband, you took a picture of my husband's foot.
Well, you know what? Now we have our trusty model once again. Now, unfortunately, this model doesn't have a bunion on it, but I think you guys have a photograph.
Yeah, we just put it up.
Absolutely. And it's an outgrowth of this bone right here, and unfortunately, that actually can be caused by
the high
heels. I mean, men have shoes that are culprits too as well.
But what exactly is a bunion? Is it blood? Is it
No, it's an actual bone. It's an outgrowth of this bone right here. It's an angular deformity.
We're deforming our feet by our shoes.
Yeah, you're deforming. It's almost like if you look at my hand and you put your shoes into high heels, it kind of, it actually bends that toe over, and that bone right here is that big bump.
That's what's sticking out is bone?
That's bone, yes.
So can I just stop wearing the high heels and it'll go away, or do I need surgery?
No, it's actually a surgical procedure.
I one time had to go to UCA Medical Center because I had an ingrown toenail in my big toe.
It's the grossest.
Oh my goodness. They sliced my big toe to get it out of there.
Absolutely. Yeah.
How do we get them?
Again, shoes can be the culprit. Some people cutting their nails inappropriately.
Too short,
get
stuck underneath.
That nail just grows right in there.
What's bursitis?
Bursitis is irritation. It's a soft tissue growth in areas of bumps. Like you can have a bursa on your bunion, or you can have it in your heel, what's called retrocalcaneal bursitis, where these can kind of irritate the back of the heel, as those shoes as well.
But you said a bursa. What is a bursa?
It's a soft tissue mass. It forms as like protection from irritation.
Okay. How do I treat that? How do I get rid of that? Can I just rub it off or scrape it or get a pedicure or something?
Sometimes that can result in a surgical procedure as well. But sometimes women use padding and things of that nature to kind of reduce it.
Is it covered by insurance?
Yes, if it's causing you a lot of problems, it's caused by insured.
And I've heard of a lot of foot things. I never heard of neuroma. What's that? And what does it look like?
Neuroma, we can use this in between your toes. You have these bones right here, and what they do is they can irritate the nerve that's in between those bones. And I mean, that can be done by ambulation, activity, and things of that nature. And what it does, it irritates that nerve that's in between the bones.
Yep.
And that bone,
I see it all swollen up in that illustration right there.
Exactly, that's it. And that nerve swells. And sometimes that's injection therapy, or that could be a surgical procedure.
Well, the equipment indicates we're done. So, Doctor, great to see you.
Thanks for coming in. We appreciate it.
How do we get a hold of you in case our feet are hurting right now?
Well, you know what? I have a wonderful website called mybadfeet.com where we have a mybadfeet.com.
I can remember that one.
Yeah, so we have a good blog on there to discuss a lot of these problems, and I can also be seen at Urban Health Initiatives in South Philadelphia.
Thanks for coming in, Doc. We appreciate it. Thank you.
Good
to see you.
Get out of there, giving you the foot.
Hey, before we take a break here, real quickly, let's say hello to Sharon. Hopefully her feet aren't hurting this morning. Sharon, thanks for watching the show every morning. Good